Hi, I'm Martha Kempner. I'm a sexual health educator and writer. I work with nonprofits and brands, and I have a weekly newsletter called Sex on Wednesday. I'm really excited to be working with the American Sexual Health Association and its project, the National Cervical Cancer Coalition, to promote cervical health. January is Cervical Health Awareness Month, and I'm thrilled to have Alysia Reiner and Dr. Karen Tang with me to talk about what we can do to preserve our cervical health and prevent cervical cancer. Alysia is an actress. She is known for for Orange is the New Black and Better Things, which is one of my all-time favorite shows. She has a personal experience with an abnormal pap smear that she's going to tell us about, and was driven to become really an outspoken advocate for prevention and screening. She also just finished 2 seasons of Shining Vale with Courtney Cox, and we're going to have to talk about it because in that show, there's the main character isn't believed that she has pain and she's called hysterical,
Yep,
which
yep.
brings us, it's a great segue to Dr. Karen Tang, who's
Right.
our other guest today. She's a gynecological surgeon and pain specialist, and she has a great TikTok, I don't know what you call it, a TikTok page, a TikTok presence, a TikTok
Accounts,
account.
yeah, thing.
But she's correcting myths and misinformation on TikTok all the time. And she has a new book coming out in May that's actually called It's Not Hysteria,
Not
Everything You Need to Know
hysteria.
About Reproductive Health. There it is. And
There it
with a
is.
little vulva on the cover, yes?
Yeah, it's like
Um,
a vulva
and
flame. Yes, yeah.
exactly. So thank you both for being here. And we're just gonna talk a little bit about what we can do really to promote cervical health awareness and then also to take care of our own cervical health. So I want to start with Alysia. Can you tell us your story? I know it was a number of years ago, but it really inspired you to become an advocate.
Yeah, and I want to start by thanking both of you for being here and for being advocates. It's so important that we talk about this stuff, and I don't think anybody wants to, and specifically you, Karen, like it's so important that we talk about pain. I think a lot of people don't go to their gyno, don't get pap smears, don't want to talk like because that fear of the pain, and I think we really have to address that. And I know we'll be doing that more later, but I'm so grateful for advocates like you know i get
Thank
just
you.
I get to just share my personal story as a way to encourage people to really get checked. And I think there's also that fear of like, oh, if I do get checked, maybe I'll find out something I don't want to know. And I can be here to say it's better to find out that thing that you didn't want to know and get it taken care of and live to see another day than wait
Mhm.
and wait and wait and wait. And then things could get a lot worse. And I also want to like start by recognizing my white privilege and that it is in this what do I want to say, forum, it is incredibly important that we talk about and advocate for women of color, because if you've read any statistics and you know anything, women are not believed about their pain, and
Mhm.
women of color are not believed about their pain and their discomfort and their symptoms in like horrific numbers. You guys might have the numbers in ways that I
Mm.
don't, and I'm sure you can talk about, but it's so important that we talk about this because that's how we make change. So a couple years after I had my daughter, I had an abnormal pap, um, which was really scary. And I was told to come back in 3 months. And one of my best friends actually just had this, and we talked it through, and she did the exact same things I did. We like tried to eat healthier and took special supplements and did all the things to try and like, oh, what can we do to help support our body's immune system as best we can. And thank God she got a normal pap after her abnormal pap. I did not. I got a second abnormal pap. And then they had to do a biopsy on the cells, which they did, and they did find some precancerous cells. And then they did what's called a LEAP procedure, where they essentially scrape, and if I get any of this wrong, you guys can both correct me.
Don't
They
worry about it. Okay.
scrape the first couple of layers of cells off your cervix, and they get rid of all of the precancerous cells. And then you go through a healing. I had a little bit of a, what do I want to say? A challenge around that healing. And then like I've had normal PAPs ever since, and it's been
That's
over
great.
10 years now. Yeah. And when I found out personally about the vaccine and the efficacy of the vaccine, it's something that I really wanted to share, because I don't want anyone to have to go through what I went through. And particularly like as a mother of a daughter, and I've heard now of sons as well, it's important
Mhm.
that we really talk about this. We talk about prevention. There's a really easy way to prevent this. And the statistics of when we do take that vaccine, it like the statistics are incredibly positive about the outcome. So that's a little bit
So I
about.
want to jump in here for a
Yeah.
second because I really do want to talk about HPV vaccines. Those are super important. Before we do it, I want to just get back to Alicia's story. Can
Yeah.
you tell us, Dr. Tang? I know I
Mhm.
had an abnormal pap smear in
Mhm.
my early 20s. I did not have a leap. I think you might tell me what I had. I refer to it as having my cervix acid washed. It was the 90s.
Yeah.
We were wearing acid wash jeans.
Massive wash.
But
That's
but
hilarious.
if you could tell, I don't know if you know what the doctor actually told me, but
Yeah.
how common are abnormal pap smears? What do they mean? And what
Mhm.
are people supposed to do to follow up?
Sure. And so I just want to say, first of all, Alysia just covered so many amazing points that, like, we have to cover, like, I really want to make sure we hit all of them, including your mention about, like some of the racial disparities in outcomes. Cervical cancer is actually a really interesting cancer in that it could be completely alleviated, like almost completely eradicated, because it's almost always caused by this virus called HPV, human papilloma virus, which is sexually transmitted. And so it is actually the number one most common cancer among women in other countries. But in countries where we have access to the vaccine, to some of these procedures that can treat precancers, like LEAP procedures, to prevent it from progressing to cancer, you have all of these different ways to try and prevent it from turning into cancer. So it really is, a situation where if you have access to the resources, to the screening, to the prevention, that we could prevent this from happening to almost anyone. So it is, a really fascinating, almost like a success story in a lot of ways. Like I say, cervical cancer and breast cancer are really quite, powerful success stories when it comes to cancer and what can happen with advocacy and awareness. But there's so many of these little, like, you got to kind of like do this, that, the other, the vaccine is one, and like kind of, getting awareness out about the safety of the vaccine. There's a lot of myths surrounding HPV vaccination. Does it encourage, like kids to be like promiscuous? Obviously not. So there's a lot of these sort of social things that have kind of interfered in these sort of perfect scenarios where, like, in a perfect world, like everyone get vaccinated, everyone would have like, like kind of these early steps that would catch and treat precancer, but it doesn't always kind of end up that way. So just to kind of go back to Martha's question about, what are these things? So abnormal pap smears are super common, just to kind of put that out there. Going back to Alicia's point about, fear, a lot of times people will get this news, your pap smear is abnormal, we need to have you come back in and do additional tests. And they get really scared because they're like, oh my gosh, what does this mean? What's going to happen? So if someone has an abnormal pap smear, it's almost always just mild changes from HPV. HPV, first of all, is incredibly common. Something like, like 70, 80% of people who are sexually active will have HPV at some point. It's incredibly common. It has nothing to do with number, like promiscuity, things like that. It has everything to do with just the fact that it's a very, very common virus. It's very easy to transmit. So for that same reason, it's really common for people to have these mild abnormal pap smears. And like your friend, a lot of times they come back with just little changes. We watch it, your body eventually clears it with your own immune system, and then you go on with your life. But in some situations, either it's a more aggressive strain of HPV, they're more like kind of like high risk strains, we call them, that are more likely to cause precancerous changes. Or if someone's immune system is suppressed with things like smoking, or if they're on immune suppressant medications,
I actually
then
want
they're
to
less likely to clear it.
I want to add something around that, which is at the time I was breastfeeding, and one of the things that was talked about was my body was under extra stress. And one
Mm-hmm.
of the things my doctor actually said was maybe stop breastfeeding because my kid was of the age that I could, like, she was over 1, and and my doctor felt like, oh, my body was under extra stress, and maybe bringing that extra stress level off of it would be really helpful, which I found really interesting. I'm super curious your thoughts about that.
I mean, it's not an official recommendation. I will say, actually, pregnancy, you are immune suppressed in pregnancy. So it could have been some of that as well,
Yeah,
residual,
yeah.
like your body is still a little bit suppressed. And so we actually quite commonly find people will have abnormal PAPs in pregnancy, even if they hadn't had it before.
Yeah.
So it's sort of an interesting thing. And in general, like just like you were saying, a lot of times people kind of blame themselves or be like, oh my gosh, I just didn't eat right, or my immune system was weak because I was working too hard. You don't have to like kind of like, it's not like that where, you caused it in any way by breastfeeding or anything. So we don't officially tell people like you have to stop breastfeeding for, abnormal PAPs, but it is a good point that anything that really kind of runs you down or, puts a lot of strain on your immune system, like can potentially contribute to these abnormal cells. So the first step, if someone gets an abnormal PAP, depends on what the abnormal PAP is. There's sometimes such mild abnormalities that we're like, that's really nothing. We're not going to do anything with it. We just watch it. So we tell some people, just come back in a certain amount of time. We're going to repeat the PAP and just watch you closely. We do this especially with really young women. So women 21 to 24, if you have a mild abnormal PAP, like almost never is it going to be a cancer. So we usually just watch those patients closely. But, for a certain level of abnormality, or if you're over, 24 and you have a, abnormal PAP, we do what's called a colposcopy, which is basically, I tell people, we just look really up close to the cervix, and we do actually put a mild acid on it. It sounds scary, but it's basically just vinegar. It's like glorified vinegar. It's acetic acid, and we put just like a little wash of that on the cervix, and that actually turns the HPV cells white, so you can see them with the naked eye. And then we take little biopsies to sample the tissue. PAPs are not the most accurate test. They're just sort of loose cells kind of floating around in liquid. So you can't really tell, is it cancer? Is it, what is it? We have to get a little bit of a better sample. So that's what a colposcopy is. In terms of discomfort, like I will say it's interesting that I do a lot of social media. I hear a lot of stories about what people go through when they have a colposcopy. I'll say, like, as a pain specialist, I'm kind of particularly aware of making sure my patients are really comfortable. I make sure I use like the smallest possible instrument size. So I'm not taking like an enormous biopsy. I take just enough to be able to see. I try and do it really quickly. We try and distract the patient, make sure they're really comfortable. And most of my patients feel very little, or maybe they feel like a super quick pinch. Yeah.
I want to ask a question. One of the things my new doctor does that I really like, and I don't know if this is common, is she has me cough.
Yeah.
And that really helps the pain factor. And I was
Isn't
like,
that interesting? There
why
are studies
hasn't
on
anyone
that.
ever made me do this before?
Can you believe it or not? Someone actually studied this. I actually put it in my book that it's actually equally effective as giving local anesthetic. I don't know why that is,
Wow.
but just something about,
I
because
remember
the biopsy is so quick. Something about just like distraction, noise, like having your senses kind of be occupied elsewhere. Just for that second, like if for whatever reason it's as effective for the biopsies for cervix
Can I ask
as
you, can I ask
numbing
Rose
it. Yeah, it's
to
interesting.
go back one second and just remind people that the pap smear itself, which is the pap smear or the HPV test, which is the initial step of getting screened, is not at all painful.
Right. Yeah.
Can you just explain how one does a pap and who
Yep.
should get one and when?
Yeah, that's a great question. So just kind of taking a step back. So the pap smear, people may have heard it described different ways, like it's scraping. It's actually not scraping. It's just a brush. We just take a soft
The
brush or like a little
mascara brush.
spatula. Yeah, it's a
It
literally
looks
just like
like
a
a
little like
mascara
kind of,
brush.
it literally looks like a little tiny brush. Yeah. Or like I use one that looks like a little broom. It's like a little white broom. So what we do is people may have seen the speculum, which is basically the little duckbill that we use to open the walls so we can see the cervix at the end. It looks like a little donut. Um, and basically we just open it up just to see, and we just take that brush and we just like touch the cervix and it just picks up loose cells. So that's what I was saying, with it literally just like little loose cells just come off the surface. We kind of swirl it in a liquid, and literally the pathologists just kind of take that liquid and they inspect the cells of the cervix and how they look. So the recommendations, and the recommendations are interestingly different in different countries. It's based on how common cervical cancer is, what resources they have. But in the United States, we recommend age 21. And this is different. Back when I'm in my mid 40s, like, it used to be we would start when you were sexually active, when you were 18. We don't do that anymore because, again, now we know more about the fact that, 17-year-olds are not going to, have cervical cancer. It develops over a period of many years. And so we no longer, do PAPs super early just because it's just going to lead to unnecessary procedures. So we start at age 21, no matter what, if you're sexually active, if you had many partners, it doesn't matter. So we actually start at age 21, even if you haven't been sexually active, just because there is a tiny percentage that's not based on HPV. So there are some very, very few, like way less than 1% of cervical cancers that are not HPV or sexually related. So we do tell people to start, even if they haven't been sexually active. So a little bit of it is sort of like, discussing with the patient. Like we never say like, oh, you're 21, you gotta like, sit down, we're going to do this to you. We have a discussion about, like what they're going to feel, like how do they feel comfortable. Sometimes if people haven't been sexually active, they just don't feel comfortable with the idea of a pelvic exam, and that's totally their right. But the recommendation is that, and we sort of discuss that. So in general, the speculum exam can be really uncomfortable just for like, from a just exam perspective. It just feels like a lot of pressure or stretching. If someone hasn't been sexually active, it can be more uncomfortable. But there's a little trick in that we have different size speculums. So they're what's called pediatric size ones that we use are really, really small and narrow, that we use for, teenagers, people who haven't been sexually active, or women on the other end of the spectrum who are, postmenopausal, who, may not have been sexually active for a long time and they have some narrowing. So there are some things, again, that we can do to make it as comfortable as possible for people. And the actual PAP itself just takes like 10 seconds. Yeah.
Another thing I love that my doctor does is she warms up the speculum.
Yes.
It's not this icy cold thing. It's warm. I'm trying to think if she uses, I know when she does like a sonogram, she always uses lube on that. And I think I think these are the conversations that it's really important we be specific about, because otherwise, like, you're like, what's happening to me?
What's going on?
Like,
yeah.
Nobody ever told me these
think,
things, and I think sometimes if a parent tells you, you kind of tune out, or if a teacher tells you, but to have this resource in this moment, I'm like, I really hope people listen and be like, oh, that's what's happening down there, you know?
I was about to say, so sadly, like, oh, sorry, go ahead. Yeah.
No, I'm remembering when I was a peer sex educator in college, if you were going to go get birth control at the college health center, you had to come to a session first to learn about all your birth control options. And one of the things we did was talk you through a pelvic exam. And I'm old, but I'm not this old. We had a reel-to-reel projector. We were still using a reel-to-reel projector, and we showed a movie with this woman with like really straight blonde hair, wearing bell bottoms, and going to get, we called it Marsha Brady Gets a Pelvic. So it was way outdated at the time, but it was actually really helpful to people who might be nervous about going in to get this exam. It showed you what a speculum was. The doctor walked her through every step. I learned things in it about, like how close your ovaries are, so that where the doctor puts her hands to feel it, right? So I think, it's unfortunate that people don't have access to something like that all
Yeah.
the time. And also to
Yeah.
doctors who are as nice as yours, Alysia, because I have never had a doctor warm a speculum for me.
Oh
Oh,
my God. Oh
I have a new
no.
doctor who
They should warm it.
I
Oh
love so
gosh. Yeah.
much. Like I love her
That's great.
so much. And part of it
A
was
plus.
because the person who did the leap, I didn't love that much. And I was like, okay, this is not my person.
I
And
think that's actually a good point too, though, is that we are allowed to shop around for doctors.
oh yeah.
Yeah.
Oh
Yeah.
You
yeah.
don't have to just
Shop
pick the person.
around for your doctor.
Yes. Yeah,
Um,
absolutely. I tell people it's like, not everyone is a match for everyone, like different styles and things. But I will say that they should all be trying to kind of like, cater to the patient's comfort. Like it just seems like, like I don't know anybody who doesn't warm the speculums. Like I'm like, that's just like a given. But oh man. Yeah.
I gotta find a new one. Definitely.
I know. I will say
I'll
with
give
the
you a
exam. So,
referral. Yeah.
yeah, I don't know. When I was a student, like we were trained to tell the patient what we were doing, and so again, a lot of these things where I'm like, well, isn't this what they're all supposed to do? We're supposed to say like, especially if it's a first exam, like if someone's never had a pelvic and they don't know what is going to happen, like you should be like, okay, we're going to be discussing these things. This is what the exam is going to be like. Here's what I'm going to be doing. Here's what you might feel. Let me know if anything's uncomfortable. I'm trying to and kind of talk you through ways to make it more comfortable. So in theory, every gynecologist should be doing this. But, again, having heard enough from social media from people who have had gynecologists who didn't do all that. If at any point, I just tell people, like, if you feel like anything is uncomfortable, both kind of just like emotionally or physically, like you can tell them to stop. Like you could be like, whoa, like what? Yeah, I don't understand kind of what you're doing right now. Can you please stop and just take a second just to explain, what you're doing? Like
And
can we
also
talk
like,
about ways to make it more comfortable? That's
sorry to interrupt, but like
Yeah.
it's really okay to say, ow, that hurts, stop.
Yeah.
Like it is your body and it is so important, just like we talk about in every aspect of life, be it physical or emotional. You can always say, ow, that hurts, stop.
Yes. Exactly.
I don't think we're trained to do that with doctors, right? Ever.
I think just in general,
especially as
like
women,
just women in
like
general,
we're
I
trained to
feel
like
like
smile and like,
Yeah.
oh, it's okay, I can handle pain, and no, just no.
Yeah, I was about to say just kind of like a broader cultural thing that I think women are sort of just taught to be like, oh God, like don't embarrass yourself, like don't say anything, like don't show weakness. But yeah, you absolutely can be like, ow, that hurts. Like, please, could you stop for a second? Like, I don't feel comfortable. Like, that is absolutely everyone's right. And in terms of just kind of knowing what's going on. So, in my book, my editor actually made a point, and this chapter didn't exist before my editor said you should put this chapter in, is what to expect with gynecologic exams and procedures and how to make them more comfortable. So she literally like, look, so many people are just, they don't know, like people don't tell them, like it's not something you learn in school or from your parents about what you're going to experience. Like what is a speculum? What does it feel like? What is a PAP? What do they do during an exam? So, we really like kind of walked like literally from like you walk in the door, like here's who you may talk to, here's what they may ask you, this is what a speculum is, it may feel like this. We talk about the different sizes. So it is something that like basically everyone should have like this information, but unfortunately just culturally like it isn't something that was ever really kind of made a priority. I will say, like on the flip side, I remember as a medical student doing a urology rotation, and it was equally bad over there. Like they were doing prostate exams, and the poor men were like, "What?" And they would just do the exam. So I think it is just in general, like just not having this like
ironically
openness about like explaining
like
to patients. Yeah.
The only thing I know about boys is like you hear those stories of like them holding their balls and telling them to cough. Do you know what I mean? Like that's all I know about what a boy exam is.
Yeah.
I also
can I ask?
Say, like, oh
yeah,
go ahead, Mark.
No, please go ahead. You go ahead.
No, I was gonna change the subject for a second because I feel like this has been a lot of information, and we're talking about pain, we're talking about like sort of scary stuff. So I was like, let's have a little quick palate cleanser and talk about like how sex is good for the body.
No, I like it.
We
This is
don't
great.
talk about that.
Yeah.
And if you have been vaccinated and you are in it and you're practicing safe sex, I think it's really important that we talk about how sex is really good for us. Because there's, again, the fear factor, the pain factor, but let's take a moment and talk about how sex is good for us. Karen, I'll let you lead.
I love that. So can I tell you, I just did a podcast with Sasha Peterson from like Pretty Little Liars, and like her podcast is very like, like positive and about like, kind of these great things about like, sexuality and womanhood. And I literally, as we were discussing, I realized, like the context that we talk about sexual education is always about like
Sucks.
danger, like prevent this, like, prevent STDs, pregnancy that's unwanted, like all these things. And it's never about like, how do you like have a healthy and fulfilling, enjoyable sex life? And so it was like this, like moment where I really like, we need to change this dialogue.
I think it's
I love
really
this. Yeah.
important that we talk about it. Like, this is a really positive thing. I love sex. It brings me outrageous joy.
That is fabulous.
I've been a sex educator for a lot of years, and I think what we're afraid of is similar to what we're afraid of with, with the HPV vaccine, right? If we tell people it feels good, teenagers in particular, if we tell people that they're going to be protected, then they're going to go out and be, super promiscuous, which is, first of all, research has shown over and over and over again that that doesn't happen. The HPV vaccine doesn't impact people's sex lives. Sex education doesn't make people more sexually active. And I think it's almost an adult fear of telling young people that sex feels good. And then what happens is they grow up to be adults who don't really know that, or at least don't focus on that.
Yeah.
Alysia, what kind of advocacy have you done around that other than this right here?
I want to hear Karen's answer, because I really want to hear from like the professional why it's good for us.
Oh my God, there's so many things. I've actually made videos on like the health benefits of like orgasm and masturbation. Like, honestly, it really is like beneficial physically. Like, so, I mean, let alone that just it's enjoyable when you're having sex, but like there are some health benefits in terms of like, you get endorphins and like, believe it or not, like cardiovascular health. It's like a cardio. It's so there are a lot of different like actual like physical health benefits to, having a healthy sex life. But just in general, like, we're sexual beings, like we're meant to enjoy sex, like with one partner, with many partners. The whole concept of like the sexual health is just to support people so they can have the sex life that they want to have in a way that they are safe. So, we do talk about some of, like the infections and the cervical cancer and HPV, but in a way so that, people don't have to like live in fear, but that they can be, like smart and careful and live their best life physically, emotionally, everything. And so, but yeah, just like Martha said, like a lot of people will think, oh my gosh, if you say it's enjoyable, then the kids are all going to run out and be crazy. But that's why you pair it with like the facts, and like this is how you use birth control, and this is how you use like like barrier contraceptives to prevent STDs, and this is why you get STD testing and your Pap smear. So you have to pair like the joy and the positivity with like like this is how you do it safely. But I love this. This is amazing. I'm glad we tackled this. It's great.
Yeah, joy. To me, it's like joy and education is everything. That's, I think as an artist, that's the goal, right? Is like, how can I joyfully educate people in an entertaining and like in an entertaining way that is fun and not just all like
like danger, like all this
danger.
So since we mentioned safe sex, I do want to turn us to the HPV vaccine for a second. And I want to actually start. I'm going to ask Alysia, you say, how can you joyfully educate? I have found myself as a parent with a lot of friends of kids of the same age, educating other parents about the HPV vaccine. Have you ever found yourself in that situation?
So like where the kids are educating the parents?
No, although that's great. I learned so much from my 13-year-old.
Yeah.
I mean, seriously, they're constantly like, Mom, your information's outdated, and I'm a sex educator. No, I'm sorry. I was talking about, so just, I'll give an example. I was sitting in the pediatrician's office. My kids were still way too young to get the HPV vaccine, but I struck up a conversation with another parent, and her kid was maybe 11, which is, when the HPV vaccine starts. And she said something, I honestly don't think I brought it up, but I'm me, so I might have. And she's like, "Oh, I don't know if I'm gonna get that one. I've read a lot of things about it." And so I'm just wondering if in your advocacy work you've come across parents or other people who have been opposed to the HPV vaccine.
I don't think I have actually.
Yay!
That's
Like
good.
I have to say, it's one of those ones that everybody's like, "Oh yeah, that's a really good idea," and more so than any other vaccine I've ever heard of, quite frankly. And um, you know, people who might be like, "Well, do you really need the chicken pox?" Or like, "Yeah, you need the HPV vaccine."
Yeah, like
Um,
it's a cancer vaccine.
Exactly. It's like it's
Yeah.
kind of a no-brainer for everyone I've encountered. My questions actually for you guys are
Mhm.
what what age, what age is recommended? And also, as I touched on earlier, I heard sort of mumblings recently, and I don't pay attention, quite frankly, because I have a girl baby. Um, what like about males having the vaccine as
Yeah.
well. So I'm really
Yeah,
curious.
it is now approved for
Yeah.
both, like, like boys and girls. And
Yeah.
so I think it's recommended, yeah, like starting age 11, 12. So I, 3 kids, two of them have gotten the vaccine. So literally as soon as they turn like 11, 12, we're like, bam, we're doing the vaccine series. It was like not even a question. But yeah, it's for everyone. And the whole concept is, like, because it does protect against other HPV related cancers. So, like oral cancer,
Yeah.
anal cancer, penile cancer. So, both in terms of protecting the boys, but also just to decrease the amount of HPV in the whole system.
Exactly.
That's the idea, is that the less HPV there is, the less that everyone's at risk. So, that's how all vaccines work in general, just kind of decrease that pool so that it's less likely that you'll get exposed.
I
And it is
feel like
actually now approved for up to age 45 for women. So I have had patients who either they're not in a monogamous relationship, they're no longer, they have new partners, and then they get the vaccine as well. So as long as there's a potential that you could have another HPV exposure at some point in the future,
yeah,
we
yeah,
recommend
yeah.
you get it. And so
I love that. I've never heard that. Like 45 is really, really, really important to hear and to share. Because I have a lot of friends around that age range who are single. So that's incredibly good to hear.
yeah,
Um,
it's a relative.
yeah,
I think in the last like 2 years, maybe I can't remember when it changed, but it wasn't that long ago that they changed that.
and then I also want to ask about, like, I'm so glad we talked about boys because
Mhm.
I feel like that's new information to me, and I want to share that with as many people as possible. And anybody listening, please share that,
Yeah.
especially like that it protects men. I think when it started as a female thing, and I'm
Mhm.
so glad to hear and share that it's not gender specific. And
Exactly. Yeah.
said a series of vaccines. How many vaccines is it? Because again, I think information is power.
Yeah, I think the version that they give to children now is, I think, a series of two. For adults, it's
Mhm.
still three.
Okay.
So I think, it is a couple of times that you do have to come back if you're getting it when you're
Yeah.
older, but it's still totally worth it. Like we mentioned, there are virtually no significant like adverse effects. It's like just like any other vaccine where it's
Yeah.
like a local like
Yeah.
irritation or like feeling faint or something like that, but no significant long-term effects that they found. So very, very, very safe. I think Martha has a bunch of statistics. I don't know if you'll share that as part of
I was
this.
gonna pipe in with a
Yeah,
statistic right now.
yeah, like
There's some,
90% like of
yeah,
cancer, cervical cancer could be prevented with this
right. I
vaccine,
mean,
which
so
is huge.
so the
Yeah.
statistics we know, so we're all a little older than this. So the HPV vaccine was introduced in 2006, and we know that since then, among teen girls, infections with the types of cancers that are covered by the HPV vaccine have dropped by 88%.
Wow.
So
Yeah.
that's huge.
Amazing.
Huge.
And right, experts have estimated that we could basically eliminate cervical cancer with widespread use. I'm really excited, Alysia, that you haven't heard any of the stigma around HPV vaccines, but I do think it still exists. First of all, we all know that we're living in an era of anti-vaccine misinformation everywhere. We know that the COVID vaccine really was attacked politically, and the HPV vaccine has, at least in the past, gotten caught in between both the politics of anti-vaccines, the misinformation of vaccines in general, and the politics of young people having sex,
Of sex.
right? So
Yeah.
I think when it was first, Dr. Tang just said it's a cancer vaccine. When it was first introduced, I think a lot of doctors were like, we want to protect against this STD and we want to vaccinate your 9 or 11-year-old. And parents were like, whoa, right? My 9 or 11-year-old isn't having sex.
I love
Yeah.
that you brought that up, because as a storyteller, it's all about the storytelling, right?
Mhm.
And I do remember when it was first introduced, I was not a mother yet. It was definitely introduced. It didn't feel like, because I was way under 45 when it was first introduced, and it didn't feel like it was for adults at all. It felt like it was only, like, my remembering of it
Mhm.
was it was only for young people. And I was skeptical of it at first, of like, why? And I think that's because the storytelling was, it was
Mhm.
about STDs, not cancer. If someone
Yeah.
immediately came out, if the storytelling around the HPV vaccine was, this is an anti-cancer vaccine, aren't we lucky that we've actually found a vaccine that can protect you from cancer? Everybody would have started, like, everyone
Yeah.
would have lined up like the
Good
COVID
hope, yeah.
vaccine. But it was definitely not introduced in that manner. And that's, I think it's a really important point to talk about in reference to medicine and science.
Mhm.
How we tell the story is really,
Yeah.
really important. And it can have super beneficial effects, and it can have really detrimental effects.
Yeah, absolutely. And especially like sex and kids, and people are just like could not compute that concept of
Yeah.
like, well, why are you talking STDs with like my like 10-year-olds? Like that doesn't they're not going to be having sex for years. And so it did sort of get like kind of like all of these like the messaging, around like the feelings that it sort of stirred up in parents. Like you said, if you just kind of came out and you're like, this will protect your kids against cancer, it's the most common cancer among women in the world. It will like markedly like virtually eliminate the risk of cancer. And be like, of course I would do that for my child. Like that just only makes sense. And I think at this point, like I can't remember the exact statistics, but something like hundreds of millions of doses, like some large amount of dose has been given. Again, no major side effects. It's extremely effective. It really is one of these like kind of like major wins of public health. But yeah, like I think in terms of messaging, I say a lot because I do the social media, and I also like, I have the foot in the two worlds of like the medicine, public health, and like the social media. And I see how sometimes like they just kind of like miss each other, like the way that the kind of the general public thinks and talks, and the way that like the medical like establishment thinks and talks, like sometimes they just kind of completely miss each other. And so it is interesting. I almost feel like I'm a translator in some ways, like trying to kind of, okay, this is how people will want to hear the message, and this is what will, these are the facts that they need. So yeah, that's it.
And I'm also going to add, like, shameless plug for one of my friends' books, Wonder Drug by Jennifer Vandervees. I don't know if you guys read it. It's an incredible book about like pharmaceuticals and how sometimes pharmaceutical companies can storytell in a way that are not useful for the public. And it's really, really, really important that we acknowledge that so we can make change.
Absolutely.
So I just want to kind of to close out the part on HPV vaccines, Dr. Kang, can you just remind us who should be getting them and at what age?
Yeah. So again, I think for the ideal age is before someone's sexually active, because the point is to give you that immunity. Like they don't protect against every single strain of HPV. There are hundreds of strains, but the version I think believe that is most common in the United States now, Gardasil 9, has like the 9 strains, the most dangerous ones. They also protect against some of the strains that cause genital warts. So in general, I believe like for children, they're recommending starting something like age like 11, 12. And then for adults, like most insurance insurances will cover up to age 25. So, when I see patients for annual exams, if they're in their teens, their early 20s, I'll ask if they had the vaccine. If they are up to age 25 and they haven't, I'm like, you should get it. So again, the insurance coverage is almost kind of like part of who gets it and who, when they can get it. So I tell people up to age 25, pretty much always your insurance will cover it. And then again, FDA approval wise, they recently did approve Gardasil for up to age 45. So some insurances may or may not pay for it, but I think it's still worth it. Like if someone, pays out of pocket, for the vaccine, I think it's still worth it as well. And so, and then in general,
And you tell them it's a cancer vaccine.
Oh yeah, absolutely. Yeah. So I mentioned like cancer vaccine, like genital warts. We still obviously have to do the Pap screening because it doesn't protect against every single type of HPV, but your protection is, your risk of the dangerous HPV is markedly reduced.
Mm-hmm.
And can I ask you one other question about screening? I know that there's a difference between a Pap test and an HPV test.
Oh, yes. Yeah.
Can you explain that difference to us?
Yeah, so the Pap itself is what we mentioned where you're looking under the microscope at the cells. So Papa Nicolau is the doctor who invented it. And literally, like we take the cells, we look under the microscope and describe how they look. So if they look abnormal, then, that's an abnormal Pap smear. So the HPV screening test is actually for high risk strains of HPV, the ones that are more associated with cervical precancer or cancer. We don't screen everybody for that at this time. The current most common guidelines in the US are start at age 30. And the reason is that because just so many people have HPV in their 20s, like everyone would be positive. So, in your 20s, if you have HPV, if it's not causing the abnormal cells, we almost kind of don't care. We wait for your body to kind of clear it because most people with HPV will clear it on their own. But if you get to age 30 and you still have HPV, it's kind of lingered a little bit, then we start to look a little bit more closely. So it's tested on the same specimen. So you don't have to do a separate test. It's the same, like when we do the brush, we just ask the lab to check for the HPV status. So we check for what's called high risk HPV. It's a little bit of, more detail than you guys need to know, but there are some times with younger patients, we do ask them to give us the status because it helps to triage mild abnormal Pap. Sometimes we're like, well, is it concerning? Is it not? We do ask the lab sometimes to tell us what the status is. But generally we're not screening the whole public until they reach age 30. And it is starting to kind of be something that different medical professional societies are looking at, whether just HPV screening alone is enough, because it is actually a very good predictive test. If someone doesn't have a high risk HPV, their risk of cervical cancer is extremely low. This is more helpful in other countries, where they may not have the lab facilities to read the Paps. It may be easier just to kind of send, for just a quick, yes, no, do you have HPV or not, rather than have a pathologist with a microscope, screening all the cells. So it is something that may be more helpful in a different setting where they may not have as many pathologists or something like that. So it is I think the American Cancer Society says you could just do HPV screening alone. Most of us gynecologists prefer to have all the information we can get. So we want to know what the cells look like. We want to know the HPV status. So we tend to use them both together. But it is something where you may hear people saying, you could just do HPV by itself as a test.
And if either of those tests come back either positive for HPV or abnormal for the Pap, what do you tell your patients to do next?
So again, there's a whole algorithm. So it depends on how abnormal, it depends on which HPV strains it is. So we basically, we'll either tell people, like we mentioned, it's a little abnormal. We're just going to watch it. Your likelihood of something, precancerous is really low. Or we can kind of go up to we need to do a little bit more testing. And that's where the colposcopy comes in, where we take samples and get a better idea of it. And sometimes if the tests, the biopsies come back with a precancerous change, and then that's where we talk about, do you need a LEAP procedure? Do you need treatment? We will say actually that there are some precancers that don't need treatment, meaning that there's a ranking system. So what's called moderate dysplasia, which is kind of right in the middle. About half the time your body will still get rid of those on on its own. So, there are some times where people are, look, I kind of want to minimize the number of procedures. I don't want to, cause issues with weakening of my cervix. Like, I'd rather just watch it. So there are certain times with precancers we'll even just watch it. But obviously every situation, the doctor has to kind of like look at the data and like what the result is, and then kind of counsel on, what are the risks of treatment? What are the risks of just watching it? Like, if you just watch it, it gets worse, becomes cancer. So there's a whole discussion. Again, it's all about like having that communication and talking about your options and the risks and benefits.
But I think something goes back to something that you said at the beginning, Alysia, which is it's better to know, right?
Yeah.
Like, go get your tests, get your results.
And also back to like shopping for a great doctor, because you want a doctor who's really educational and who is really sharing all of the steps and all of the options, and what's possible, and what the pros and cons to all of it is.
Yeah. There are definitely some doctors who are like more on the paternalistic side. We're like, well, you're just going to get this. But in an ideal world, they should be saying, here are your various options. And one of those options for everything is you could just watch and wait. Now, obviously there's risks sometimes to that, but, but to talk you through, like, what would happen if you choose this option, if you choose this option, if you choose this option, how would you choose what's important to you? So, like, again, we talk to the patient, because like for some patients, they want to be as aggressive as possible, even if it's not that concerning. So, or like the flip side, someone's like, look, I really want to minimize like doing procedures. I'd rather take my chances and watch. And so, it's all about kind of like talking people through so they have all the information they need to make that choice for themselves. And like, I love this point about that. It's most important to know, because, especially for something like cervical cancer, where you could prevent it if you catch it early. A lot of times people are scared, Martha said, like, what if I find something? And then that fear makes people stay away from the doctor, because I just don't want to get that bad news. Like, I'd rather just kind of like hope that it goes away. The worst case scenario is truly like, if you could have prevented a cancer, but you didn't. I always tell people the only one that suffers is you, like if you're nervous about going to the doctor, or like, like asking questions and like bothering the doctor, like, don't worry about that. Don't, like, you should always feel like you can get the care that you need. And if that takes like a different doctor treating you differently, or talking with you in a different way, or making you more comfortable, you should do that. Because like I said, the worst outcome would be that if you had something preventable and you could have acted early, and for whatever factors made you wait, and then it was too late. And so, like I've had, unfortunately, again, like cervical cancer isn't that common anymore. So I've only diagnosed like a handful in like, like 15 years of practice. The saddest cases were ones who are just lovely, lovely, women. They were always older, and, like they were always women who had not seen the doctor for a super long time. And they started bleeding, and they started having like, like pain. And then you're like, oh my gosh, you had advanced cervical cancer. And it's always the worst when you're like, oh my gosh, if you had just, if you had just gotten your pap smears, like for all those years, like you could have treated it. And like, so and that's why that's why this sort of thing is so important. Don't let fear, don't let like, like a bad relationship with your doctor get in your way. Yeah.
I want to throw in one thing. The one thing I want to say is like, bring a friend, like if you need, like, bring support. If you don't have a family member, bring a friend and ask, like, you can ask a friend to come with you. Ask for help. If it's scary to you, ask for help, The other thing I just want to talk about is pain. Like, with a LEEP procedure, with it, like, if you're very sensitive to pain, what are the options?
Excuse
me. You're a
specialist. Yeah, exactly. I know. So LEEPs are usually treated with just local anesthetic. We like really numb up the cervix. And again, I'm very aggressive with local anesthetic. I numb the crap out of it. So most people will be fine with that in the office. Now, I always get a sense like, like if someone had a lot of discomfort with like the colposcopy, or even just with pap smear, some people just with the speculum are really uncomfortable. Then you start talking about more of like, do we need to like do this under sedation? So I do LEEPs in the OR under sedation for people who are just like, look, like they really just like feel the pain more intensely. like you can do it with sedation. It's harder, like, again, it's a little bit more challenging with like, office sedation for like, everything, just because like, there's insurance coverage. The insurance doesn't cover it. That's a whole misogynistic thing as well. Like they don't cover this sort of thing. It's the worst. But we sometimes will prescribe things like Xanax, we do local anesthetic for certain procedures. Like, we really try and kind of make it as comfortable as possible, or for the people, again, who just can't tolerate it in the office, like do under sedation in the OR and just be like, we have to like bring in the big guns. So, we want to make sure that it's done in a way that you can, be comfortable, get the care that you need, and are not like, oh my gosh, this was like the worst ever. Like, I never, want to go through this. We should never have patients kind of feeling that. And so, an ideal situation, you talk through that, like, and have the conversation again before you do it. Like, if you're just like, look, can you please talk me through like what my options are to make this as comfortable as possible? Because I'm kind of nervous about this. And so,
that's so great. Yeah. So great.
Yeah.
Well, thank you both for joining us. This was great. I think we went back and forth and all over the place.
We talked about a lot.
We really did.
Including
like
the joy of sex. Don't
Yes,
forget, we're talking about something that brings a lot of joy. Just do it in a safe way.
Absolutely. That's perfect. That's a perfect like kind of summary. Yeah, it's great. Yeah.
Exactly. That was a great sign off. So thank you so much. And we hope to talk to you guys again soon.
Awesome.
All right. Thank you. Thank you so much.
Such a pleasure.
It was nice meeting you guys.